எக்ஸ்கியூஸ் மீ, கீழே பார்த்தா அமெரிக்கா தெரியும்,
மேலே பார்த்தா ஆப்பிரிக்கா தெரியும்.
கோட் வேர்ட் அக்செப்டட்.
தேங்க்யூ.
Our esteemed dean to inaugurate the function. So we have Dr. Kumar Sonaidan. We got 12 microscopes and we have got all this section. Marco, Timon, and Petitive. So everywhere, one things. But if you have got the same course, you will about 20-25 of they have not themselves. Maybe they got other instruments. Older they got it. Everything has been arranged. So go on, everything there. Basic sense of things. What is that? Then we are going to all the patient of the expression. Lab inspector, policy to modified actors as well. Step by step, 14 modules and there are 4 sessions. We got seniors and juniors. Seniors will get bonding and after the juniors. Then we also have rhinology and technique surgeries. The policy department is kind enough to provide us all the data. So we are very much thankful to them. And Dr. Sunli, she said she will come tomorrow. The thing is, since we cannot transfer bodies to the mortuary to here, so we want to plan the next session over there, as well as the next. So one request is at least some basic things. We don't need the high-end microscope, so just for the sake of the endoscopy. Good morning to everyone. I'm pleased to see all of you here today. For those of you who don't know me, I'm an orthopedic surgeon, being a director of BNCRI. Been with the institute for more than 32 years now, been HOD for 15 years, with orthopedics. And during today's function, today's program is a workshop. I would like to congratulate Dr. Karthik and the entire team of EMT going out of the way, and he is probably one of the HODs who's very active, and he's gone out of the way to take all of you to this workshop. So as you all know, how much ever you read theory, how much ever you do chemicals, the exposure, you will not be able to directly operate on patients because you will be assisting your faculty. So if at all you need hands-on experience, it will only be in these workshops. So the idea is you can do your mistakes and learn with these bones, and also similarly we also have a simulation center in BMC. So this skill center has been there
And as Dr. Karthik told me, it is not being used by many departments, many of the departments. So again, I would like to congratulate him for making use of our skill lab. And maybe I will can please put the pictures in the HOD group, and we will stimulate the other HODs also to come and use this innovation lab in DMC for the PTs. So again, I would like to thank the faculty, the external faculty who has come all the way to be part of this workshop. Salma company, Salma for giving these microscopes and supporting this workshop. Thank you very much. And of course, with this student faculty, outside external faculty, and also faculty from our own department and Karthik, under the guidance of Karthik, I'm sure you will benefit for today, and you'll have a wonderful learning experience. And wish you all the best. May this workshop, wishing all this workshop of the success. Thank you very much.
Thank you. Those were very kind words. And as a token of gratitude and appreciation, I would like to present this book. Thank you very much. You made our day something.
Please continue and not we learn. Please continue. Learn as much as you can. Thank you, sir.
Thank you guys. That part of certain food state. So higher experiment, both of them evidence service. So they have here on that ship or existing student exchange program, all these things are about materializing. Right moments are carried out in the same place. Like this,
You can see this is the root of zygoma. It should be anterior plane, and see which side is the tip. If it is on the right, it is the right side. And if it is pointed towards the left, left side. So now identify all the landmarks. This is the linear temporal edge. This roughly corresponds to the Mediterranean fossa dura. And you can see this is the spine of inlay. And of course, you have here tympanomastoid suture line. What is the importance of this suture line, tympanomastoid suture line? What is? So let it be interactive rather than me speaking. Give mic and so this is the tympanomastoid suture line and tympanosquamous.
ನೆಕ್ಸ್ಟ್ ನೋಡ್ಕೊತಾ ಇದ್ದಾರೆ.
ಸೆಂಟ್ರಲ್ ತೂತಾದ್ರೆ ಏನು ಮಾಡೋದು?
ಎಲ್ಲಿ ತೂಕಾದ್ರೆ ಸೆಕೆಂಡ್ರಿ ಕೊಲೆಕ್ಟರ್ ಮಾಡಿ ನೋ ದ್ಯಾಟ್ ನೋ ಫಾರ್ ಎಕ್ಸಾಕ್ಟ್ ಸೆಕೆಂಡ್ರಿ.
Thank you, madam. Department is ever necessary. All of them are really enjoying the show. They have the budget is there, so each unit will have two bones. So we have got 24 bones. They're really happy, and some of the bones are very well preserved. These are all fresh. You should see the anatomy and all that. Plus, here also and when we got it, it is only this is a nice place. The microscope. Yesterday was really good. But yesterday was basic, so these people should know the basics. Advanced. Actually, another one.
Five of them attend every week. Five of them come
Last year, we were very ready to do technology and techniques. He wants to do this session, we have to take permission from them. So I told them,
mostly ಅಲ್ಲಿ ಮಾಡೋದ್ರಿಂದ ಚೆನ್ನಾಗಿ
only blocks.
we have an somewhere
Three tables here, three
one
bodies.
will ಅನ್ನೋಣ
And if you have to do a CM, two bodies.
learning purpose they are welcome anytime. Only thing they cannot take away from the world. You can do it there.
Madam, make for
My section we never see.
all those things. Just fun. Just fun. Keep it in mind. You have to respect every person. Even if it is dead body, you have to respect that, because tomorrow something legal happens. Everybody will need. So that's the reason why I tell people, don't lose any bones. All bones are accounted for. All right.
Good morning, all. Congratulations. You are all welcome. Anytime in the day for dissection. Taking out from the bone is very risky for us. Depends on the individual doctor who takes this. Suppose I give a bone. Tomorrow, after 10 days or 15 days or a month, that person is identified, and if they want a second postmortem or an explanation, and if the bone is not there, then we are in trouble. Or if you make a documentation, I note down in my PM report that bone is given to ENT for academic purpose, and you maintain the chain of custody, that is fine. But once I think to do the dissection, it will be in pieces. So on paper, if we make any documentation, we are absolutely wrong. in this section, any time you can come. 5 of at a time you can come. We never say no for dissection. Taking the temporal bone is very, very risky for us. I have seen many of the
Oh, awesome.
Yes. I joined it.
Of his lateral development. If you are able to see the pyramid and you are already seeing the stapedius muscle, what does it mean? As simple as damaging the facial nerve. Here, so the facial nerve is lateral. Here, this is the line that you have seen. This is the facial nerve, and then this is the pyramid below that is medial. So if you are seeing the stapedius muscle, if you already exposed means if you are going here, you will have damage. Very important. So if you go there, see how nicely the buttress is preserved here. This is the posterior angle. Come out so that you can see. This is your incus. This is the posterior thing. And then you can see the same thing continues down here. This is the reticular process and it is very inserted there. And then this is the stapes. This is the footplate of stapes, posterior crura. And then you got the pyramid here. And then this the stapedius muscle attaching to the neck of stapes. This